Hey everyone, my name's Olivia, and today I'll be talking about the effects of supplementing with vitamin K on diabetes, type 2 diabetes, and insulin response. Yeah, so vitamin K is a fat-soluble vitamin, just like vitamins A, D, and E, meaning that it dissolves in fat, it's present in fat-containing foods, and it doesn't dissolve in water like water-soluble vitamins. Um, and there's two types of vitamin K, and they're very different. So the first type is vitamin K1, is also known as phylloquinone, and vitamin K2, which is known as menaquinone. Um, so vitamin K1 is mostly found in plants, in leafy greens, um, and vitamin K2 is found in animal source foods, um, animal fats, and it's found in fermented foods, and it's very scarcely found in plants. Um, so again, some sources of K1 would be kale, liver, spinach, parsley. Um, but the body has a difficult time absorbing vitamin K1. And then vitamin K2 is found in things such as liver, egg yolk, butter, yogurt, fermented plants. Um, so yeah, it's mostly found in animal products. And so according to a 2019 review, um, research suggests that the body absorbs 10 times more vitamin K2 than vitamin K1. The body just has a lot more difficult time digesting and absorbing vitamin K1. And then another source of K2 is the conversion of vitamin K1 into vitamin K2 via the gut bacteria. Um, yeah, so storage, these two, although they're both vitamin K, they're stored in different ways in the body. The body stores vitamin K1 in the liver, heart, and pancreas, while K2 occurs in high concentrations in the brain and kidneys. Um, so when it comes to absorption, K1 is absorbed in the small intestine. K2 is absorbed by passive diffusion from ileum and colon. And vitamin A and vitamin E are vitamin K antagonists. Um, the function of vitamin K is involved in blood clotting, bone development, regulating blood calcium levels. It, vitamin K facilitates energy production in the mitochondria, and it's an antioxidant that protects cellular membranes from damage due to free radicals. A deficiency of vitamin K, um, the risks of this include increasing the time that it takes for your blood to clot, making it more likely for somebody to bleed out, or it increases the risk of hemorrhage. Um, a deficiency in vitamin K can also reduce bone mineralization, which can lead to low bone density, or osteoporosis. So it's a very rare deficiency, and most people are able to get enough vitamin K from their diet. Toxicity, there's no known toxicity associated with high doses of vitamin K1 or K2 from food, but there is a synthetic vitamin K that it's called menadione, and the only toxicity from vitamin K comes from this synthetic vitamin K. And there's no tolerable upper limit that's been established for vitamin K. Um, so there are some claims with vitamin K's effect on type 2 diabetes. Um, so a little bit about diabetes is it's just a continuing major public health problem around the world. And in recent years, there's been evidence that um, basically studies and clinical trials have shown that type 2 diabetes can be reduced by vitamin K2 supplementation. Um, so individuals with type 2 diabetes are not only suffering from significant emotional and physical misery, but they're also at a increased risk of dying from severe complications. So this finding could be very important for them, very crucial. And this data that you're looking at is from a systemic review that proposed that vitamin K2 improved insulin sensitivity through involvement of vitamin K dependent protein, osteocalcin, um, and due to anti inflammatory properties and through lipid lowering effects. Vitamin K2 had a better effect than vitamin K1 on type 2 diabetes, according to this systemic review. So there are 3 articles that I'm going to be discussing today. The first article published in 2008, it was a 36-month trial. Second article, 2011, and Article 3 published in 2010. These articles are from trustworthy sources, accurate sources. They're relevant. They're somewhat old, but there's a very limited amount of studies on this topic. Um, but yeah, so I'm going to go into more depth on those studies shortly. So my PICO question would be, does supplementing with vitamin K in amounts that are obtainable from diet alone for 6 months improve insulin response in type 2 diabetics? So the first article that I'm going to be discussing, this is a 36-month trial. It's a randomized double-blind trial designed to assess the impact of supplementation with 500 micrograms per day of vitamin K1. There were 355 subjects included. These were older non-diabetic men and women between the age of 60 and 80 years old. The measures taken were they were testing insulin resistance, and they measured it by using the homeostasis model assessment, also known as HOMA-IR, and they measured this at 36 months. They also measured fasting plasma insulin and fasting glucose as secondary outcomes. And the results of this study was that the effect of 36 months of vitamin K supplementation on HOMA-IR, which is the insulin resistance, it was different between the two sexes. Um, the insulin resistance was statistically significantly lower at the 36-month visit among men versus their control group, but there was actually no statistically significant differences in the outcome measures between women and their control group. So the conclusion was that vitamin K supplementation for 36 months at doses attainable in the diet may reduce progression of insulin resistance in older men. Article 2. So the research design and method for this article was a double-blind placebo-controlled study with 18 subjects in the treatment group and 15 subjects in the control group. They supplemented with 30 milligrams of vitamin K2 or a placebo for 4 weeks. There was a median age of 29 and BMIs of around 25 in both the testing group, the treatment group, and the control group. Um, the measures were frequently sampled intravenous glucose tolerance test to determine the insulin response, the insulin sensitivity index, as well as the acute insulin response to glucose and disposition index before and after treatment. Um, so then there are also some inflammatory markers that they measured as well. So the results here were that vitamin K2 supplementation significantly increased insulin sensitivity and disposition index, but these were not affected by the placebo treatment. Um, the percent increase in DI was significantly higher in the vitamin K2 group compared with the placebo group, resulting in higher post-treatment DI. Treatment with vitamin K2 decreased the inflammatory marker UCOC and increased COC. However, no significant changes were observed in the in the insulin response to glucose, so AIR, and the fasting plasma glucose, and the weight was not different. The IL-6, the interleukin-6, the C-reactive protein, or the adiponectin. Um, so the conclusion here, this study demonstrated this was the first time that vitamin K2 supplementation increased insulin sensitivity in healthy young men. And this is 4 weeks, and this improvement in insulin sensitivity seemed to be related to increased COC rather than modulation of inflammation. So it wasn't the correction of inflammation that made these individuals more insulin sensitive, is what it's saying. Um, so Article 3, the objective was to investigate whether dietary vitamin K1 or 2 and K2 intakes are related to the risk of type 2 diabetes. The method and design was um, there was 38,000 Dutch men and women between the age of 20 and 70 Um, the dietary K1 and K2 intakes were assessed using a validated food frequency questionnaire. Diabetes case patients were ascertained mainly via self-report and verified. So they reported whether or not they were diagnosed with diabetes at any point, and these reports were verified with medical records. And then the occurrence of diabetes during the follow-up was self-reported. So participants were asked whether diabetes was diagnosed and what year and by whom and what treatment was received. The results, so during 10 years of follow-up, 918 incident cases of diabetes were documented. Um, so, um, so basically, this study found that there was for vitamin K1, um, higher intake of vitamin K1 tended to be associated with a reduced risk of type 2 diabetes. For vitamin K2 intake, there is a linear inverse association with risk of type 2 diabetes for each 10 microgram increment. Um, and there was really no difference between sex, um, nor with waist circumference or BMI. So the conclusions of this study was that this was a large study of over 38,000 individuals. Both vitamin K1 and K2 intakes were associated with a reduced risk of type 2 diabetes. This association was a linear inverse for vitamin K2, um, whereas a significant risk reduction for vitamin K1 was observed at higher intakes in particular. Um, so at lower intakes of vitamin K1, there wasn't really any um, difference with the occurrence of type 2 diabetes, but the higher intakes was when there started to be a, a significant risk reduction. So high dietary vitamin K intake was associated with lower C-reactive protein concentrations and an improved blood lipid profile. So this article had some limitations as to the fact that these individuals were self-reporting their vitamin K intake, so it can always have some inaccuracies with self-reporting. But the strengths here, there's a lot of strengths as to the very large study size and the large sample size. Sorry, and um, I mean it's a 5 and 10 year follow-up, so well 3 to 5 year intervals, and then a 10-year follow-up as well. So this is a very long study with a large sample size. Um, so my answer to my PICO question was, so all the studies shows and revealed a link between vitamin K supplementation and intake and improved insulin response. Um, but the first study only used K1 and there was only improvement on the men and not the women. The second study, again, it was all male subjects, so we don't know the effects on females. The second study was a very small sample size, and it was only a 4-week study, so it's hard to say the long-term effects. And then the third study, it did use both vitamin K1 and K2, and both were associated with lowering type 2 diabetes in both sexes. Um, but more observations are required to determine if vitamin K is effective for both sexes for improving insulin response.